we are introducing Dr. Ajay Jayashilan for psychology course. So today, as an introduction, sir will be talking about the counseling and breaking bad news. So this psychology course will be useful for you for all these medical licensing exams, USMLE, PLEB, AMC, and ERPM, even for specialized exams, MRC or GMRCP, it will be useful. So Dr. Ajay Jayashilan is a senior lecturer. So he has done diploma in psychology and counseling and MS Special and advanced diploma in teaching and training, IVQ level 3. So he's a MCGP. He has done MBA in UK, MCGP and MIT BCCT in UK. So sir is very well experienced in training. He is an international trainer actually. So we are glad Dr. Ajay Jayashilan sir is here with us and will be joining Maura Education soon. So hereby, I would like to invite him to take over this meeting and address you all. Thank you.
All right. Good evening to everybody, and thank you very much, Dr. Rajivan and team. It is a pleasure to join you all and Maura Education. I'm looking forward for many years of good educative stuff to come in, and I'm very happy to join. So I'm from Sri Lanka, Kandy, Sri Lanka, and basically, I mean, thank you for the introduction, right? So can I share my presentation? Right. Am I audible, and can you see the presentation?
Yes, yes, we can.
Okay, fine. Right. Thank you. Okay, so if you all can see this picture, can do different places or what physical sort of a session to make it interesting. And I'm at 9 p.m. at the night, so basically, I think if you don't get interactive, I may feel sleepy. So I will surely love you all, basically to make it more interactive. So can you all basically see this picture? And I need about 2-3 comments on it. What is just take few seconds. What is the first impression that you get out of this? Unmute, talk. If you want to get your video out, I'm really fine to see your face, or just unmute. What do you see in this? Can I have some answers? Let's interact, please. What do you see happening in this picture? Yeah, can we have some answers if you don't mind? Just what do you think is happening here? Right, there is a doctor and it looks like a patient. So what's happening? What is their expressions?
Bad news is being delivered.
Very good, very good, excellent. So thank you very much, Shakira. Right, thank you so much. Anything else? Anybody wants to sort of add to this? Any other comments you have?
Doctor is reassuring the patient.
Very good, Ruanta. Thank you so much. Right, perfect. So you have 2 brilliant answers. Do you have anything else as a last chance? Somebody wants to comment. A last chance. Somebody wants to comment. So we got breaking bad news, and we got doctor reassuring the patient. Right. So perfect. Thank you. And what do you see here? Anybody else can answer, or the same people? What do you see here? What do you think is happening here now? Ruanta, can you come out of it? Do you think the patient is reassured now by looking at this picture?
Yeah, she says it's okay or something like that.
Okay, good. Very good. Shakira, what do you think? Same thing?
Yes.
Right. All right. Cool. So basically, yes. So we have seen obviously a Breaking Bad news here, and you can see the expression on the old lady. But you can also see the doctor actually, even though the expression looks pretty serious, the doctor you can see is actually quite mellow and quite calm. Okay. And then basically she has sort of by some means made it right. And you can see she reassuring the patient at the end. Right. So basically, that's the only thing, right? So if you are depressed, you're living in the past. If you are anxious, you're living in the future. If you are at peace, you are living in the present. Remember, right? So basically, it's really pointless you being depressed and living in the past, anxious and not knowing what is going to happen. Whereas the best part of life is living in the present moment, right? So that is basically the main thing you should understand. So my topic today is tips on counseling and breaking bad news for your medical licensing exams, which is quite important. Whatever from USMLE to the PLAB to AMC to even the other, I feel even the Canadian exams, right? Even the Sri Lankan exams that we take, right? And even the exams like MRCGP, MRCP, all these exams even has a lot of counseling and breaking bad news that comes in. It's a very popular subject, right? Especially for the OSCEs, as you all know, right? A small intro. I hate this part because I don't want to just show, but then since you all don't know, so I am a family physician from Sri Lanka. I finished my MBBS, studied my schooling in Kandy, finished it in Bangalore in India. And then I am a qualified family physician with a postgraduate in family medicine. And also I am registered in UK under complementary MIT BCCT for complementary medicine. And I'm a qualified psychological counselor. And I have an MBA from the Cardiff Metropolitan UK, making me into the entrepreneur side. So I'm a senior lecturer, and also recently I got an international, a certified trainer thing from City and Guilds UK. Basically, that's short, and the others I don't want to brag. It's just a basic thing. So me being a practicing family physician and a management part, the passion took me onto being a lecturer, mentor, resource person, and now an international certified trainer. Some ground rules for you all. Basically, I hope to finish this within an hour, right? It got a bit delayed, but that's fine. Please unmute and ask questions at any time. You don't need to wait till the end. You can excuse yourself. That's the best way of learning. And I would prefer you unmute, showing your faces by, unmuting your video, but that's, I cannot force you, but that's fine. Just mute your phones, right? You know what's ergonomics, right? Basically sit straight back, don't hunch. It's going to be there for 1 hour. So you know the normal things, right? And then restroom or anything you need to go, please excuse yourself or you can move. And at the end, let's have a Q&A session. Learning objectives. By the end of this educational session, the audience will be able to understand the tips in counseling and breaking bad news in relation to any of the medical licensing exams that you wish to take. What is counseling? Basically, so that's a basic thing. What is counseling, right? According to the Mercury dictionary, counseling is giving advice. That is an opinion or instruction given in direction to the judgment or conduct of another. But I'm not very really favor for this sort of a definition because it's a bit contradictory. That's why I put it at the start itself. If you may ask me, I am totally against this giving advice. So basically, counseling is not giving advice. I will explain to you why. So if you take the father of family medicine and the book that we all learn as a family physician or a GP, that's the Murtage. It's the Australian textbook, which you all know. The therapeutic process of helping a patient to explore the nature of his or her problem in such a way that he or she determines his or her decisions about what to do without direct advice. Please make a note or reassurance of the counselor. Now, this, I wanted to compare both the definitions. Now, majority of our, psychology, the fathers of psychology have practically analyzed, and the best results you get when you get the decisions from the patient itself and not by direct advice or you influencing the patient. That's what I told you at the start. I'm not very favor for giving advice. So the best is therapeutic process of helping a patient to explore the nature of his or her problems in such a way that he or she determines his or her decisions about what to do without direct advice or reassurance from the counselor, right? If you take general practice or family practice, the counseling process is based on the therapeutic effect of the doctor. And I guess, and I feel it is, I did this basically like thinking of a family physician GP setup, but you can actually imply this to any sort of specialty. Nevertheless, it need not be, family practice. Please interrupt and ask me anytime, okay? So what counseling is an integral component of quality patient care in general practice or any specialty, right? It is an integral component. It is something that you cannot avoid. And I would say counseling is something, it's not only for medical or purpose life. You take any service-oriented job, you take banking, you take teaching, you take being a doctor, you take a lawyer, right? You take any service-oriented person, even a businessman, right, will surely, what do they do? What is marketing, right? What is marketing? What is sales? It is practically counseling your client, right? What do? You need to sell a product. Leave medicine. You want to sell a product. You sell a product through counseling, right? You can win your customer through counseling that person. So counseling is an integral component of quality patient care in any form of medicine. The public perceives that GPs can do counseling very well. Why? There's a major reason for GPs to maybe first-hand doctors, you call. Why? Because GPs and the first-hand doctors who are there are mainly primary care. And you know for a fact, maybe in Sri Lanka and a few countries, Asian countries, this practice is not there, right? But in the UK, Aussie, USA, you cannot bypass a GP or a family physician and go and see a family consultant. So basically, you need to go first to your GP or a doctor who is in that category. And basically from there, you are referred. So the GP or the family physician or the primary care doctor is the main bridge and the main person who actually knows you. So he is one of the best, or she is one of the best person perfectly placed in order for you to give you counseling, because he knows you inside out, right? But people do not generally tell the doctor or even realize that counseling is exactly what that led come to the doctor. So that's a very important fact. When you are talking about counseling, there are people who have sort of, they feel embarrassed, or they feel they don't want to tell the problem to the public or even to the doctor. So it's very hard to get a person to open up. You think about yourself and myself. it's the same per se, right? You feel very difficult to open up. Now, it's okay to talk to someone, right? Especially if you're having a bad day, right? But the picture down is not the correct way of doing counseling. What does that doctor or the counselor do? Counseling this woman, and there are people outside, open door, watching and hearing what to do. So that is not a perfect way, right? Confidentiality is one of the mainstay of counseling. What is the aim of counseling, right? To enable a person to respond more effectively to his or her situation, where a change in the behavior of the person or a change in the environments need to be brought, right? You should remember, you as a person, if you have a problem, for instance, you're depressed, you are seeking help from a counselor, right? Why? To make sure that you expect that person, the counselor or the doctor, to make a change in yourself and or the environment, right? Because you may have got depressed because of problems of your personal thing or the environment, basically. So counselor acts as an integrator. What do you mean by integrator, right? Integrator is somebody who bridges the gap, right? Basically, he connects and basically he or she sorts out the problem, right? Self-exploration to discover himself or herself what best to do in that particular situation, right? So basically, the aim of counseling, right, is this. So you basically try to change yourself. Somebody changes yourself and or the environment that is causing the issue, right? So if you may ask me, a counselor has somewhat the same responsibility you see with a doctor or a family physician, right? Basically, it's the same responsibility, right? Maybe the less of treatment, but the starting point is very important, right? Now, why is I set up a GP? Because it's sort of, I had to set it up to somebody, so I can't open it out to everybody. So let's set up a GP thing, but just basically think of it wherever you are, whatever you do. But why is a GP or a family physician an effective counselor? That's important, right? So that you can take it as not only a GP, you can take it for a counselor, you can take it for a teacher, you can take it for anybody who is a first contact doctor. It can be a consultant also, right? Because when it becomes second, third, already the second, third doctor may not get the whole picture, mind you, right? He's not going to get the whole picture, right? Because the primary doctor gets the best advice, okay? He gets the best, right, persona out of the whole thing. So they have the why? They have the opportunity to observe and I understand patients and their environment. Okay, so they have the opportunity to understand them because they know the patient. It's their patients that they may have seen these patients for 10, 15, 5, 20, 25 years. They know the family, they know the patient, they know everything out of it. Second, they are ideally placed to treat the whole patient. Family physician, there's something called, I'm getting into it, it's called patient-centered care, holistic care. You know that, right? Basically. So they are primary doctors who are classically identified to treat the patient as a whole, right? Number two, right? Then third, their generalist skills and holistic approach permit the primary centered doctor to have a broad grasp of patients' problems and a multifaceted approach to treatment. So basically, when you look at a patient as a whole patient-centered whole patient, you tend to get as a doctor, you will be able to perform something called the multifaceted approach, right? You know what it is, right? A multifaceted approach is much better than a single faceted approach. They can provide treatment in comfortable and familiar surroundings, including the doctor's room and the patient. That's extremely important, especially Asian countries. I've seen this in Sri Lanka. I'm not telling that it doesn't happen in Western countries, but maybe Western countries, it's a bit different. Here, to get something out or somebody to open up, it's very difficult, right? And they do not want to do that to a public person, right? Basically. So for comfortable to go to their own family doctor who has been treating them from their childhood, right? Basically. And then they are very comfortable because they have gone to this clinic or surgery for 10 years. So it's like their house. Okay. They're skilled at working as a member of the professional team and directing patients to more expert members of the team as necessary. So when you have a primary center doctor handling a counseling session, they also have the experience because they are comfortable with the patients, they know the family. Plus, at one point when they know that they cannot handle, they also have that liberty to refer to a person who is higher than them, maybe a psychiatrist, right? So they can readily organize contracts with the patient. What I mean by contracts is not paid contracts. Because they're very comfortable with the patients are comfortable, they can negotiate things with them, right? So basically, the patient will listen to a doctor who is their family doctor, rather than they go to another doctor or a specialist who they really don't know, right? Then they often have an intimate knowledge of the family and the family dynamics, right? So if you are looking at a primary center doctor, he already knows about that patient. As I already told you, he would have been treating even the patient from small age, even from the birth, right? So that's a great advantage. They fit comfortably into continuity patient care with appropriate follow-up treatment programs, right? So basically, it's a continuous type of, basically treatment or medical treatment. They fit into it properly because sometimes what happens is they go to a person once, twice, and they stop. And counseling, basically, an average, a usual problem. I'm not talking about a major problem, but a sort of you can call it like a mild to moderate depression, anxiety, those type of problems. Basically, it's about 4 to 6 sessions, right? Each session lasting of about 45 minutes to 1 hour, right? So that's the basic thing. So that is continuity of care. So if you don't go, you go once or twice and you stop, you can't blame the counselor also, right? It's not magic. I've just put in some problems. It's simple, but then you have more problems that you can counsel. Basically, you're talking about behavioral problems like, attention deficit hyperactivity disorder, right? Autism in children, spectrum disorder, psychosocial problems you can have, psychosexual problems you have, alcohol addiction, drug addiction, right? Marital problems, which is on the rise, as everybody knows, right? Basically, in Sri Lanka and in the world, the divorce rate has drastically increased in the last 5 years, as everybody knows. Family planning, right? Unwanted pregnancy, teenage pregnancy has really, really increased, as you all know, right? That part of the thing in this, especially in this era, these teenage problems have truly increased. Terminal illness of bereavement, this is, it's palliative care, right? Basically, and that too, the amount of cancer patients and even others like the next HIV and many other problems have truly increased, right? Due to many reasons, right? Chronic illnesses like diabetes, hypertension, bronchial asthma, right? Dyslipidemia, kidney disease, right? All these things also are in rising. Non-communicable diseases have risen, and this is also something that people need because it's a long-term treatment, right? Especially, I'm sure people who see these patients will admit that even a diabetic hypertension patient I've seen commonly, after a while, especially when the person gets into insulin, they get depressed, right? Obesity is another very common problem, hypothetically going on in the world. So basically, these are some of the things that you actually come across. And basically, these are the problems that you get counseled, right? Okay, then basically, features of counseling. What are the features of counseling, right? Now, I mean, I have written something called clear-cut treatment option like antibiotics, right? Can I have a small answer from you? This is also a trick thing that I want to do it. I mean, we can't waste a lot of time, but can we have quick answers? Do you really accept this, or you feel this is not exactly correct? This is the same thing that I brought you at that time, right? I asked you about giving advice. So I put this just a confusing thing. Quick answers, can we have it? Yes or no? That's it. Just, I mean, it's okay if you're wrong. There's nothing wrong. Is counseling a clear-cut treatment option like antibiotics? Can anybody? Can you all mute your mics if you're not talking, please, because it's disturbing others. Thank you. Right. Can somebody come out? Danushka, Anila, I mean, anybody? Can you just come out? Just tell me.
No,
Do
sir.
you think?
No.
Okay, fine. Right. Okay. Does anybody think yes? Can anybody say it's yes? Okay, fine. So most of you all think. So I agree with you totally. It is obviously not a clear-cut option. But mind you, right? Mind you, in my experience, right? I have seen patients actually getting a clear-cut option also like antibiotics. Now, I have experienced this. Is not. I'm not talking that I am a very good doctor. And it's not like, don't misunderstand me. It's not like that. But basically, what I have thought is it depends a lot. Number one, on the doctor or the counselor, obviously. Number two, on the situation and the level of the problem, right? Number three, it's how the counselee. Who is the counselee? The counselee is the client. How the counselee or the client responds to you, right? How much of positive vibe they give back to you, right? Practically, in these things, if it all comes into play, you can get perfect results. So I would not completely disagree with this statement, right? Number two, cooperative problem solving process, right? If by chance the counselee or the client cooperates properly with the counselor or the doctor, you can obviously solve the problem. As I told you in the first instance also. It is an educational venture. Oh yeah, that is something that I have realized in my career of counseling. I'm not a permanent full-time counselor, of course, because I do a lot of other things. So I'm not a person who counsels like that. But I do counsel people and I help out and I do it also as a profession. And I have realized even the little that I've done, I have learned a lot, right? And you tend to learn a lot from your clients. Development process, yes. Now, we're talking about the features of counseling, right? So what is a process where your session develops into something from being negative, where a person comes fully gone, maybe in a suicidal tendency, to where you can turn. It's a great blessing, right? If you do this, it's a great blessing. You turn the mindset of that person into a positive vibe where they actually realize that taking out their life is stupid, and they get out of that and they go on and live their life, right? So what do you call? It's a developing process. You can't do it overnight. At least 4 to 6 sessions. A change process, right? This is something good. What do you mean by stuck status? What do you mean by being stuck? Stuck is what? What do you mean by my car is stuck? my engine is stuck, is where you actually practically don't have anything and you are practically stuck and you can't move and you need to take the car to the garage. The same thing happens to us. It has happened to me several times, right? Even yesterday, day before, this happened to me, right? When you really feel it and you are down, you get stuck. And when you get stuck, you totally are confused, right? You really don't know where to go. And that's the time you need somebody else's hand, right? And do not even try to do it on your own, because I feel, I mean, some other problem. Yeah, sorry about it. I don't know what happened. This is the problem with technology, and I wish this doesn't happen again, because I hate it when this gets interrupted. Right. So let's just move on, and I hope this doesn't happen again. Okay. Right. Okay. So basically, right. So you move from something called the stuck status. So then you get out of the thing. Number one. Then
കൊടുപ്പില്ലോ മേലെ
I'll do it. I'll do it. Yeah, sorry. I don't know. This is not an issue on my side. I'm sure about it. I don't know. I hope this doesn't happen again. This is not on my side, because I use, my internet is okay, and I use a lot of Zoom for my lecturing and training, so on a daily basis. Right. Okay. Fine. Danushka, your hand is up. Do you want to ask something, or it's a mistake? You want to ask something? Okay.
No, sir. There's a problem with hearing, sir.
Right. Okay. Now you can hear me, right?
Yes, sir. Yes.
So there's an issue with the connection there. I don't know. So we'll see.
Okay, sir.
Okay. Then goal, you understood the goal. Then a process energizing patients and lifting their morale. Okay. So you know what is counseling. It actually it's a process where it energizes the patients and it lifts their morale, right? So that's what you do. If you're a proper counselor, you actually at the end of the day will lift the morale. Sensitive response to problems within a caring relationship, right? Basically, you develop a caring relationship between the patient, and it's a sensitive affair, right? Basically, right. So let's move happen again. So, what is problem-solving approaches in counseling? Number one, listen to the problem of first presentation. Now, a person comes to you. The best part of the thing is where you can hear the person first time, right? Because once the story comes in, if you go to another person, most likely it won't be like the first time. You go to the third person, it will be still different. Either it will be exaggerated, or it will be less, or it will be modified to some level, because you don't have a RAM or a REM or whatever that hardware that you have, right, in a laptop or a computer, right? So you're not going to repeat the same. But if the patient comes to me, this has happened, I've realized that if the patient comes to me first, I get the best hand. So remember, first presentation is very important. So a primary care doctor sits on that, right? He gets the best view of the problem. Communication skills also are there, right? Where you need to have, right, facilitation, silence, clarification, reflection, paraphrasing, confrontation, and summary. Listen, I won't be able, I don't think will have time to go too much deep into it, and I don't want to. So just note these words down and just Google and see and just get the meaning. So you need to facilitate the problem. Right? You need to basically go with the patient, right? You need to make sure that the patient is involved with you. Silence is golden, right? So you won't believe a person becomes silent at one point. That also means something. Remember, right? Clarification. There's some problem. The client has all the right to clarify. You have all the right to clarify. Reflection. This is something that I do a lot, right? This is something I do a lot when I teach and train. I love this part, right? This and humor I love, because this is something where you reflect on your life or somebody of yours. Now, that does not mean that you give all intimate details, not that, but there are things that you can give, and it really works. And I have experimented this, and now I do it very much in all my classes, because it really helps, because even the person forgets the issue, they remember the story. So reflection, paraphrasing, and confrontation. You need to confront that patient. At one point they are stuck. You need to give them a boost. Confront them. Why did you do this? Why didn't you do this? You need to ask those things. That's extremely important. And finally, you summarize. You need to basically give a feedback. So these are some of the communication skills you need to have in a proper counseling session as a counselor or a doctor. Defining the problem in behavioral terms, right? Basically, any problem you define, you get it. Even in your life, just think about, right? More than theory, you have to know theory. But counseling, psychology is something where it's more practical. Even doing medicine, even being a doctor, right? Remember, you need theory. Of course, yeah, no doubt. But just imagine if you don't know anything practical. Is it going to work? No. I'm talking about any specialty. Establishment of a contract for counseling. This is what I think told about 2 slides before this, right? How you establish a contract, right? You establish a contract with the counselor. Basically, that will give you a very good, solid relationship. And how you do it only makes whether the client is going to open up to you or not. Right? You be stern, put your leg up, and be like a big guy, right? They're like, what the hell is this? And they'll just walk out, right? So what do you need to do there? That is where empathy comes in. Can somebody tell me what's empathy? quick. I think I can't this thing a lot, but we should have some memory. What is empathy? It's a normal word, right? What do you mean by empathy?
A personal feeling for someone.
Very good. Thank you. That's yoga. Thank you so much, right? Basically, you fit into the shoes of your client. You need to move in to the heart and soul and mind of your client to get the best results, right? You being a big, PhD guy or girl, somebody comes in, you will be in that level on top and expect them to come in. It's not going to serve any purpose, right? You need to come down to their level. So this is how you sign a contract. Define short and long-term goals. So if there is a problem, right? I'm not going to take too much of time, just simple stuff. You need to define those problems in means of short and long-term goals. Now, this is something that you can do in anything, right? You do a business, you start a business, same thing, right? You do a hospital or a clinic, same thing. What do? You first categorize your goals into two. You cannot have everything that you're going to do within 1 year. No, first you have a goal, 3 months, 6 months, 9 months, 1 year, up to 2 years. That's short term. Then you think of your next thing, like getting your MRI, getting your CT scan, you're setting up a cardiac unit. You can't do it in 3 months. I'm talking about a small setup. You earn that, you budget it, and then you say, okay, in 2 years, I'm going to do this. In 3 years, in 5 years, I'm going to make it a fully fledged hospital. So that the same thing, you put it into your client, right? So you can't just give them 10 things and say, okay, fine, this is the thing, no problem. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, go home, do it. They're not going to do even one. I bet you they're not going to do even one. It's a foolish thing to do. But you separate it. Every counseling session you give them, I give maximum 3 things to do. I don't exceed more than 3. And I tell my students on the same thing. And they come to me and say, that's very practical. Right? Sometimes I've done about 5, but normally I give about 3. So you give about 3 to 4 every session, make it into a short term, and then you give the next 3 to 4 at the end as long term. Decide on one action, right? And this also sometimes I've seen counselors sort of messing up. Why? Right? They just are all over. You know the word all over, right? So basically the person comes saying he's depressed and I'm going to commit suicide. You need to find the root cause of that depression, the root cause why this person is trying to commit suicide, take it out and then move on, right? The person has to move on. They can't get stuck. You can't make that situation worse. There are people who make this situation worse. They give about 10 things to do, right? And basically that person will feel like committing suicide there and then, right? So basically decide on one action. Best thing. Building an action plan. You sit with the person, you empathize with the person, you really make a rapport, you get that relationship, you actively listen to the problem and you don't keep talking. And how do you do an action plan? You need to basically get the results from themselves. That's what you call proper counseling. Active listening, and you get the session, get that problem sorted. You ask them what they want to do, and you just give a push. So that's why I told you it is not giving advice, right? Evaluate the progress. Once that happens in the second session, third session, you bring them back, you check what it is. Have they done the exercises? Yes, no. No means failure. Yes means, okay, fine. Has it been a proper thing? So you evaluate the progress. What do I do next? Right? So there's a problem here. I need to sort it out. Or they are successfully going on. So then I can go to the next step. Continue action of select another option, evaluate the progress again, and terminate or refer. So if there's something doesn't happen, you bring it back, you do the action, again you add it. And basically at the end of the day, you need to terminate, right? Terminating is also a very important thing. Number one, if you are really satisfied and you have done your thing and you are sort of sure that there's no issue, then you terminate that whole session. If by chance you cannot and there's an issue and it's not successful, what do? You need to refer to somebody higher than you. a psychiatrist, a senior psychologist. So don't do things that you can't. That is going to mess up things, especially counseling and treating. You're playing around with lives. This is what I tell a lot of my colleagues and students, right? It's not like you work in an IT company or something where you are with machines, right? It's with lives. So you need to be very careful on that. Just a few examples. You have something called counseling model. So just go and read this. I'm not going to explain this. For sexual problems, there's something called implicit model. And for medical related, like counseling stuff, like abortion, contraception, sterilization, there's something called medical counseling model, where you counsel the person. If a person wants abortion, how do you counsel and get that person out of it? Because in Sri Lanka, abortion is illegal, right? Right. So basically, we are going to talk about patient care and holistic care. What is the definition of health? I want to just refresh your mind. WHO says it's a complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Remember that, right? It's a combination of physical, mental, and social well-being, and it's not only just a disease being absent. Patient-centered care is the patient is number one, and not you. Right? So gone are the days that you practice doctor-centered care. It's no more. It's now patient-centered care. Remember that, right? And basically, holistic care is what you treat the patient as a whole. Somebody comes with you just for a headache. You will miss the diagnosis. A lot of doctors do this if you only treat the headache. They say it's you need to treat the patient and not the problem. Remember that. A good physician treats the person and not the issue. There is a saying like that, right? You would have seen that. So you need to treat the whole patient. So counselor is actually in this situation of patient-centered holistic care is a facilitator who actually facilitates the problem and directs it properly. Meaning he facilitates and makes sure that the problem does not get worse. You go to a counselor and it's pointless if the problem gets worse. You don't go to a counselor to get the problem worse, obviously, right? Non-directed counseling techniques, there are some things which are not directly linked and non-directed. So that's called, you don't need to know all this. I just want to tell you that there are things like that. Directly you counsel, indirectly also you can counsel. Doctor-centered approach is used for patients who are so confused and wrong. So there is some sort of instance, I just want to put this is also controversial. Now, doctor-centered is totally out, right? But basically, when you talk about sort of mentally decapitated patients, people who are really, have, issues like that, right? Basically, those type of people, you cannot get things out of them. At that point, I think the advising and the doctor-centered care and that approach comes in, because you can't expect them, their IQ is less and a lot of things. You can't expect them to narrate, right? Okay. Interviewing skills for effective counseling, right? So I'm not going too much into depth, just something. Number one is how you connect with them is from the start, as I told you, from the greeting of the patient to active listening to making sure that the person gets a trust where the environment is confidential and how you approach the patient and you won't approach in a way which is demeaning. It's called establishing rapport, right? How you maintain your eye contact, and you should be very careful if it is the opposite sex, especially, right? How does that work out? You have to be very careful. So all those things, right? Basically, that's how you positively establish a rapport. And then how do you empathize with that patient? You show the empathy. Right? There are many things, but I think for you all, I just didn't want to confuse too much, so I just put the main thing. Basically, how you establish rapport and how you empathize, and that has the whole crux inside of having a proper. I would say I call it an interviewing skill, right? And remember, interviewing is not one way, interviewing is two ways, right? And counseling is not one way. What is empathetic understanding? Understand the patient both verbally as well as behaviorally. So you have to go into that person, not only understanding what they're talking, but also understanding exactly what their behavior is. Now, this is something very interesting I picked up, right? You will empathize with the person very well if you use something called your third ear. And there's something called third eye also. This is not morally installed in you, but it is a cognitive thing. You know what is cognition, right? Cognition is your unconscious mind, which is embedded with your feelings, thoughts, and emotions and behaviors, right? So a third ear is connected to your cognitive thing. So basically, this is one of the most important things. That's why cognitive behavior therapy is one of the most used psychotherapy techniques in the world, right? Because you can really get a lot of things which you can't see from outside on the patient. So that's your third ear. Other interview skills, like I won't take a lot of time, reflective back to the patient, right? So you reflect your thing so that you give an example. Use silence for patients to express emotion. So you actually give them, like, silence. You give them a period of silence, right? For them to like think, take a break. Understanding what the patient is feeling. You need to like sit and also understand. You can't be always talking. You need to also be silent. Otherwise, you're not going to understand exactly what the patient is talking. Observe lack of congruence, right? The lack of like the relationship wise, right? And offer supportive comments. Like sometimes you need to give a little bit of push when a person is really down. Okay, prompt the patient. Again, somebody gets stuck, somebody gets silent. What happens? You need to prompt the patient. Summarize what patient says, right? So basically, you do all this. So I have explained this before, so I don't want to take a lot of time. So basically, this is how you make a proper counseling session. Also, counseling, I have made it very easy. Stages in counseling. I have made it into E's, 5 E's. What are those? So it's very easy. Establishing rapport, exploration, examination, elaborate an action, and end. So it's like I have put it in more of a clinical term, right? Now, when we do psychology, we don't learn like this. We learn it in different ways. But this is more of into medical related. So it's easy, right? The mnemonic, 5 E's. You first establish a rapport. From the time the patient enters in, you basically welcome them, from that how you introduce them, how the patient environment is, confidentiality. You make sure the person is comfortable. You don't make unnecessary cues, right? Keep them comfortable. Give them that reassurance that you're basically with them, right? Basically trying to sort out and with them. And then you move on to actively listen to them without just jumping. Now, I have this problem also because now you can, I think jolly well you all know that I'm a person who will not stop talking, right? And this is like some of my family and my friends also say that, I don't allow the other person to talk, right? So I'm now trying my best to make it. So sometimes when I started counseling, I realized that I'm not practicing what I preach because more than the patient, I'm there sitting and talking and they're like nodding their head and listening. And I realized that there is no practical, positive thing coming out of it. But then when I started listening to them, that was a big thing. So actively listening. Then you slowly give them a push, right? So basically, these type of things will bring a lot of rapport, right? Exploration is like your, clinical skills. You explore, right? Observe. More than clinical, I think examination is clinical. It's like more of observing. That's the word, right? So you observe the patient. And remember that if a person talks, right? Basically, nearly only 33% is your verbal matter that you listen. Me talking to you, do you think that 100% you're listening? No, right? Since it's online, it's not practical, but if it is physical, it will really, really, really this thing. If I'm not using non-verbal things and if I don't have body language, right, you all will go to sleep now. Because mind you, nearly 60% of you listening is your body language, your non-verbal cues. Only 33 or to about 38% is your vocal and your talking. So you explore the thing, and then so you explore not only the talking thing, you observe the non-verbal things. Examine. Then you examine. It's actually examination, physical, non-physical, whatever, but it's an examination. Then after that, you make a plan and you elaborate an action. And as I told you, preferably one, maybe two, but you don't give about 5 things to do. It's not going to work. And at the end, that's the end. How do you end it? Like I told you, you do a feedback, you evaluate the progress, you get them back again, right? You need to make sure that they are getting better. And if you're fully okay, you terminate, or you think you need a referral, you need to push them out. Ethics in counseling, right? So basically, I've just put 4, but I've told you many, I think, more than this. Confidentiality is very important. You need to, you can't have another person inside. That's not counseling, no way, right? Practically confidentiality. Around only 4 walls. You go out, you can't, tell things about this person. And then she goes out or he goes out, they can't be talking about the counsel also. It's very important that you maintain that confidentiality. Case recording, you need to take some notes. That's very important, right? Because you get a lot of patients and you can't be remembering them. Competence, you need to be competent. In order to succeed as a counselor, and it's not only business oriented, to become famous, the other thing is to do some justice to a person. What do you actually need? You need competence. Social relationship with the patient. How socially you are related with the patient is very important, right? That relationship, which is called a bond, right? Which is called an attachment, should come with a boundary. Now, that is something you should know, right? This is not an affair, right? This is not a thing where you cross the boundary. Now, there are people who practically ruin it by crossing the boundary, especially if it's opposite sex. You should have that thing. There is a limit that you go on. So that is something that you learn when you go. I don't want to, it'll take a lot of time, but you should remember social relationship to an extent with a boundary, not without a boundary. Remember that. Do's and don'ts. Doctors, counseling should show genuine concern and empathy towards the patient. So I've explained that. Why? Right? Obviously, it should be genuine. It should not be fake. A lot of people do fake things, try to attract the world. That's not a good thing. Confidentiality should be maintained, as I told you. Very important. Counselors handling their own feelings is very important. Now, that's a joke that I normally crack. I hope we have a little bit of time. Yeah, fine. We started late, right? So there are things that, the patient goes and sits with the counselor, and what happens? The patient is now counseling the counselor. And the patient is now patting the counselor. And the patient is giving a tissue because listening to the counselee, the counselor starts crying. Now just imagine it happens to you. I mean, it's funny, right? So basically, you being a doctor or you need to be very, it's very hard. I have practically sometimes broken down in some cases. And I somehow now, not that I listen, but you sometimes really break down, right? As a doctor, even listening to some stories, you really feel very bad, right? Be aware of the cultural values and attitudes. Now, that is something very important, right? Especially in Sri Lanka and all over the world. There are 4 or 5 religions and languages, right? There are some religions that are more free. The westernized world. If you take the Asian sort of culture, there are some religions, how they are brought up, right? From the way they dress, from the way they talk. So you as a person have to perceive that and give that respect to them. As a doctor and a counselor, if you don't do that, I think that is one of the most, lowest things that you can do, because you cannot, practically take up somebody's self-dignity. And just because somebody is of one religion that is very conservative, that does not make that person bad or good. So make sure that you respect each one's cultural value. That is extremely important. Giving factual information. Now, that is something very important. Now, if by chance you are giving something to a person, this is called evidence-based practice, right? You know that, right? Medicine is what? Evidence-based practice. So you give them something, obviously most of them are educated now. They go onto the internet and see. It happens to me on a daily basis. They will ask you questions like this, right? And you cannot just ignore that. You can't say, no, 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 listen to me. Gone are the days that you just say, no, no, that's what I told you, you shut up and go. You can't do all that. That's what olden doctors did. Now they want answer. They are paying for you, they're coming to you, they say, you better give me this answer. You are telling me this drug. So why should I take this? Why can't I take that? Right? So you need to have factual information and should be non-judgmental and impartial. That's also very important, like I told, the cultural value. You cannot judge a person because they are of one religion or that language, or they are a male or a female. You don't do that. So basically, do's or don'ts. So I hope you understood, right? It's all basic stuff, but something called psychotherapy. What is that? It's something where you do a therapy. Now we have come sort of to the end of counseling. If by chance you don't get a patient improve with counseling, the next thing is called psychotherapy. And these therapies, you have many therapies, which I will just go through, right? I mean, there's no time to explain everything, but I will just go through. And these therapies are used with counseling, right? And if needed, on the other side, medicine, to actually make the whole thing work. So, few things. The most popular thing is cognitive behavior therapy, where you actually play with your emotions. You get the thing with your unconscious mind. So that's cognitive behavior therapy. Mindfulness, which is one of my favorites now, and that's a big hit. It's what you do in the present moment. You be non-judgmental, right? And you show it's done for stress and anxiety. There's something called psychodynamic psychotherapy. If you want, make a note, and obviously I can send this presentation if you all need. Oh, I think this is getting recorded. Yeah. Sorry. So you'll have this with you. No problem. This is read it, right? I don't think there's time for me today to explain the whole thing. Interpersonal psychotherapy is also something where you do a psychotherapy. So I've given you some studies. So you please read, right? I mean, I'll be happy even maybe in the next session when I can do more on this if needed. Cognitive hypotherapy, hypnotherapy. So you know what is hypnotherapy? This is a popular thing now. It's a combination of cognitive behavior therapy and dialectical therapy. It's called dialectical behavior therapy. Little bit read on this. I'm not going to this thing. It's more effective for suicidal tendency and depression and anxiety, severe way. Now this is catching up actually now with cognitive behavior. This is called, that is CBT. This is called DBT. So just read on this. This is something which is catching up. And art therapy. Art therapy is you using art, drawing, music. So these are a few of the psychotherapies. I'm a little bit rushing because of time, but you can ask me questions and you can read on your own also. So cognitive behavior therapy, just a quick thing. I'm not going to give a big thing on that. So mainly for anxiety, social anxiety, phobia, psychotic problems, hallucinations, delusions, insomnia, eating disorders, depression. And basically, you can sort of, it's like you getting into the unconscious mind where you take a person's thoughts, beliefs, and perceptions, right? Which is not even consciously known by the particular client or the patient. So by that, you actually get out a lot of things and show that person, see, even though you don't know, you're thinking of this in your unconscious mind. You're thinking of this behavior, and then they also get a shock. So CBT is a very, very, very practical and important thing. It really works. And if you come to think of it, I think CBT is in the world one of the most sought after and used, therapies, right? Especially for depression, anxiety, symptoms. Okay, so we are coming on to the end. So before going on to breaking bad news, what are the specific areas of counseling that you can? More than this, you can. Of course, crisis management. So now it's very important. In Sri Lanka, if you take huge crisis, huge, from financial recession to practically fuel issues. We don't have food, we don't have fuel. It's a very sad state. Government basically collapsing. People are on the road. Never this has happened. Then, with that, what's happening now? The other unfortunate thing, COVID is again starting, big time in Sri Lanka. So it's crisis after crisis. So that is something that you need counseling. Breaking bad news, I will be talking about. Bereavement, grief of loss. Somebody passes away in your family. Minimum of 6 weeks you take at least to get out of that grief, right? So remember that grief is something also which is natural and you need counseling. Depressed patient, a person is depressed, anxious, anything, you need counseling. Chronic pain, a person with cancer, right? I mean, I have experienced that with my family itself, and I've seen people in front of me, suffering and dying with pain, which is not at all, you have to give them a morphine patch, and it's practically very sad to see. Problem gambling is basically they don't know how to sort out problems. They jump from one to another and they're all over. So this is something, there are many more things, but I just want to just show you, like any problem, counseling is something that at the start you need to. You can't do it like when it is like totally blown up, but at the start, if you do, it's something that can, actually bring in some results. Right. So the last few slides, I'm sorry about the quality of this photograph, right? Basically breaking bad news. And you can see a very elderly caring doctor breaking some bad news to this lady on some issue, right? And you can see the way she's doing it, the eye contact, this girl is, bending, she is going down to that level, holding her hand. This is very good breaking bad news, not negative bad news. So breaking bad news requires very delicate communication skills. I'll be talking about it in the next slide, next slide, which will be, I think, one of the final. So breaking bad news is very delicate. You must show compassion, sensitivity, and tact, while also being clear and straightforward with your patient. It's not beating around the bush. Remember, right? Now, I also have a habit, when I break bad news, I sometimes, or majority of the time, feel so bad, especially if it's a known person, I sort of beat around the bush. And when I start doing that, the patient realizes. They realize that I'm like, trying to cover something. So it's very sensitive, right? So with compassion and that sensitivity, you combine, but you need to directly hit on the target and you be straightforward, because you're really going to hurt a person if you're going to beat around the bush. Avoiding the temptation to play down or obscure painful truths, right? I've put some studies, you go and read if you really like it. Bale et al. 2000, if you Google this, you'll get some studies. It's widely used and it's a very helpful way to structure consultation. It's called Spike's protocol. So read it. I'm not going to teach you all that. It's too much on this thing. But Spike's protocol. There are many reasons why doctors or physicians have difficulty in breaking bad news. A common concern is how the news will affect the patient. Even for me, I'm like, no way, because I hate to hurt people, right? I really don't like to, basically, that's me. And a lot of people of us are like that. We don't want to basically. So if something's going to happen and you say, okay, fine, you have a cancer and you're going to die, like you're not going to go and tell, excuse me, you have a cancer and you're going to die in about 3 months, right? You can't say that, right? And even if you want to, if you're supposed to tell that, it's so tough for me. I have been in these situations and I've taken many days to break this bad news. It's very difficult. A common concern is how the news will affect the patient. And this is often used to identify or justify withholding the bad news, right? So mostly you try to conceal a lot of the things and try to butter and put the other stuff, which is not good. But again, you're also in a very tough cookie, right? You cannot. Now, although most doctors, residents, or students realize important guidelines, the delivery of bad news, their own fears are generally of supervisory support and time constraints form barriers to their effective interaction with the patients. So barriers to breaking bad news among medical and surgical residents, so especially the students, the registrars, they have an issue because they come into barriers. When you are totally with the patient in a ward, when you are full-time with the patient in the ward, you have a lot of barriers. It's very difficult to break the barriers. Breaking bad news is generally not a one-time event. Especially, you can read this Warnock 2014 and all that. Nurses are full-time with the patient. Now just imagine the doctor comes and tells you, I'm sorry, you have a very bad pancreatic cancer and I will give you only 6 weeks to live. Now this patient is going to be in this thing and she sees the nurses circling. She will call 100 times. What is this? Am I going to die? Am I going to die? Now, what is that? That is majorly a depressing thing. Especially nurses get caught to that because they are full-time in the ward. So that is also something that is there. It's a full-time thing for nurses and families because the family is also involved in that. So another 2 more slides of just 3 ways of how to break bad news. I have just given very basic stuff, right? It's not rocket science, and I don't want to like complicate things. Usually, I teach like this, right? I mean, I think you all also should stick to that simple stuff, but you put the pointing. It's not like you getting complicated things and complicated words and all these studies. And I'm not telling you not to do that. Of course, to score a distinction or something, you need to know. But if you don't know the basics, again, there's a problem. Now, this is basics. First, selecting your words. That is very important. Like I told you, you have cancer, you're going to die tomorrow. That's not the way to tell, right? She will be dead at that moment if you tell them. Work through your own reaction, right? So the reaction, like you see in the picture, you need to work through your own reaction. Decide on the narrative. What do you mean by narrative? On your language. What words you use? What is the sound? How loud you tell, how soft you tell, right? This is narrative. Practice what you are going to say. So basically, before narrating that, you should make sure that you practice what you're going to say. So this is selecting your words. Choosing the right context. So determine if you are the right person to break the bad news, or that is also very important, right? You should know at what category it is, right? I mean, there are some things that the consultant does. There are some things that the nurses can do. There are some things you get involved. There are some things that the family gets involved. You should make sure that you don't jump the gun and mess it up. So breaking bad news is how much or how right a person does it. Ensure the physical setting is comfortable and private. As I told you at the start, you know, when you break bad news, it is a very important thing that you bring that patient to a comfortable arena. Their house, your surgery, not a place that they are not seen, and not a place where everybody is new. It's going to create a lot of problems. Choose the right time if possible, and that's extremely important. And how you choose that is under analysis of the issue, right? And that is something that I am also not really mastered yet, but that is something you need to know. And now with experience, I'm coming to. I mean, it's not at the start, and of course, it's not at the end, but you should know somewhere down the line, you need to break that. You wait too much, you regret. You go at the start and give it, you might shorten their life because they get mentally down. So choose the right time, extremely important. Assess how the recipient of the news is feeling beforehand. Now, that's something that even I don't sometimes do. When you go, you think that's the right time, but you don't go and do it for the benefit of your free time. This is patient-centered care. It's not your thing. Even if you have to go back and come back tomorrow, taking leave, you better do that, right? Because you're playing again with not a machine, but a life, right? You go there and the patient is crying, right? You go there and tell, excuse me, I'm very sorry, you have got cancer and I think you're going to die in about 2 weeks. I mean, come on, that's stupid, right? So patient is crying, you pacify that patient, you go off. And then you come back in a time where the patient is settled. So sometimes it has happened to me. You take about like 3, 4, 5 visits to start the conversation on breaking bad news, and you can't do it at the first law. Finally, delivering bad news effectively. How do you deliver the bad news, right? You signal the bad news before you dive in, right? So you give a hint before you jump in. You go for swimming at the start, right? The very tough thing for any of us is going to the deep end, and everybody's scared of the deep end. What is the first question people ask? How deep is the deep end? right? And you actually hold the side, you go first. Let's just remember the people who can swim here. Remember the days you started. I can really remember, right? First, you dive into the shallow end, then you check that pulse, then you slowly hold the sidebar. And I mean, most of us do that, but the people who are experienced will have jumped from the deep end itself. But I'm telling people, I didn't do like that. You go in, then you check the pulse, then you dive in on the other side. So that is before you give the signal or before you are going to tell something, you need to dive in. Offer comfort to the person if appropriate. Okay. It's a level of how you give comfort to the person. While giving or doing the breaking bad news, to what extent you give comfort, right? So that is important. Accept silence as a possible response. Most of the time I've realized either they react to it or they just go silent. And I mean, I've been in that situation. So I'm like, wow, what do I do? Like it's like you don't know what to do, right? They just go like proper silent. But remember that silence I told you at the start of it, it's a response. Decide what to do next. So according to the situation, you need to listen. Sometimes you go, you tell nearly half the story, and you're like, oh my God, I don't think I can do it. I'll do it the next time. You somehow shape it up, you go back, and you come the next day and again slowly start. Sometimes it takes about 5-6 attempts or more to even start the conversation, right? So in my expectation, and I'm telling you, one of the hot topics in most of the licensing exams, especially in MRCGP and all that, is breaking bad news. You go and see in OSCEs, most likely there's a breaking bad news patient. That's a very hot topic. Remember that. So I'm very happy that I was given these two topics because this is one of the most important topics for exams. I can vouch any exam you take, medically oriented, right? Breaking, not only medically, any specialty, it's breaking bad news. Okay, before finishing, just a quick thing. So I mean, I just read this. What are psychological disorders? And more than this is important. Approximately 48% of adults experience symptoms at least once in their lives, some psychological thing. Approximately 80% who experienced these symptoms in the last year did not seek treatment. In 1 year, they don't seek treatment. So that is how bad psychological ailments people go for treatment. Now it's a bit better, but in towns. But when you take remote areas, it's different. Most people seem to deal with symptoms without complete debilitation. And women have a higher prevalence of depression and anxiety. Men have a higher prevalence of personality disorder and substance abuse. These are just an extra points I thought I can show. Before finishing, Nelson Mandela once said, what did he say? It always seems impossible until it's done. So why I put this is from counseling, breaking bad news. Always I've had that thing. I had that very bad experience of, basically sort of thinking that I can't do it, right? And this thing comes in my mind, right? I'm a firm believer of quotes. I have this thing, right? I mean, I base my lectures, a lot of things on quotes. Like, it's very nice. And one of my favorites is this man. So he says it always, and he proved it in his life, right? Basically, he was jailed for 60 odd years in his life. He came back, broke up apartheid. He was the first Black African president at 83. He did so much, died, and Obama after that became the first US. So you can imagine, it always seems impossible until it's done. This thing, take it to your exams also, right? Don't give up unless it's done. Remember, I have tried to give up so many times, right? But if you don't do, you don't know where you are. These are some of my references. Murtaj I've got, and this Nandanidhi Silva is a lecture notes of Sri Lanka. The people who are Sri Lanka will know this. He's a very famous lecturer in family medicine. These are the main things and a few other internet things I took. Thank you very much. And I hope it was an informative session. And I take this opportunity to thank Dr. Rajivan and the Mora Foundation for giving me this opportunity. And this is my first appearance with you. Can we have a Q&A now? I can give you about 10 minutes. Shall we ask some questions? Right? I can answer. Any questions you all have? Right. So can we have the questions going before we finish up? Right. Thank you so much. I'm getting messages. So I'm happy. If you all are happy, that's something good. So thank you. Yeah. Can we get questions up, please? Anybody has any questions? Is this a question? What are the procedure? I'm not getting you. Whoever who did that, can you just ask me the question? It has gone. Somebody has said, what are the procedure? So I really don't know. Okay, so there are some questions I'll answer, right? So I'm keeping this anonymous. So somebody has asked, I'm not going to tell the name. Please keep I want to know what's the best kind of treatment for a husband in a bad marriage, and is it worth it? So I don't know. I don't know whether it's a female asking this question or a male. I don't want to mention the name also. So, a bit of a tricky question. What is the best kind of treatment? So, I mean, it goes both ways. So, if it's a bad marriage, I think if the wife is is the person, you have to give the treatment to the wife. And if the husband is the problem, the husband is so. I think the basic point in the Asian culture is usually the husband gets the blame for everything. So I don't know whether that's the thing. Basically, just remember the usual points of counseling, psychotherapy, medical treatment, right? So you have a marriage problem. Obviously, you try to solve it yourself. Doesn't happen. Months, years go by, noticed by the parents, the siblings, people around, they try to help you? No. Without delaying, you go into a counselor, right? Basically, what does the counselor do? The counselor will obviously make sure that he counsels the patient properly, both of them separately and together, right? So that is something that has to happen. Then, after that, if that doesn't happen, the usual thing, whether it is husband or wife, irrelevant, you do psychotherapy. Try that. Again, no. You need to then get into medicine. So it's a process, the same process for husband and wife, right? So it's nothing different. Only thing is it depends. Now, if it's a male, if the male is drinking too much because of this problem and abusing the wife, it's different. Right? That may not be, the female is not going to drink too much and abuse the husband. I mean, I don't know whether people do that, but usually it's not. So they will do it in a different way. So you need to take the matter at that point, and then you do it, right? Now, there is this question like how it is, what are the procedure? I really don't get this answer. Maujud. Like how it is, what are the procedure? If you can ask this question, I really love to have interaction. I don't know why you all are not talking. How difficult are the licensing exams? The same person has asked, right? Okay, so I will answer that question to you. Ahla, I'm sorry, I'm not pronouncing your name. I don't understand your first question. Okay, second question. Licensing exams depends on the country. Even in Sri Lanka, you have a licensing exam called Act 16. I'm not scaring you all. Usually licensing exams are tough. I don't think you can call. I don't want to just give you unnecessary hopes, right? So basically, I have just to have an idea, and sometimes I also had an idea of going abroad. So I have tried one or two, and also the Sri Lankan exams, which we come back as a foreign student, we do, and that's also pretty tough. So not discouraging you, but don't take it very easy also. But I don't think it's that tough like your postgraduate exams also. If you know the matter, I think you can easily do it. So it depends on how your knowledge is, that's all. Other than that, I don't think there's an issue. Right. Any other things you all have? I think all the others, comforting the patient or the patient's relative. Even Ala, I can't understand your questions. I'm sorry. It's like majorly you have given, there's another thing you're given shock. So I don't know. And Fatima Zima, breaking bad news, maybe. So I've explained to you all that, right? So I don't need to explain again. I did it in the slide. Please ask me questions, right? Because I'm not understanding some of your questions. Is that all, or can we have a few more questions? Because it's nice when you ask questions. I also learn actually. Anything else you want to ask? Right. Okay. So, Dr. Rajivan, are you in the audience or with the other person? Thank you again. So before finishing, I'm signing out. Thank you very much for this lovely session, and so happy to have seen. I think there were close to 77 or 80 I saw. Right now it has come to half, obviously, but then I'm happy that I kept on at least about 55 to 60 till the end. Sri Lanka again being very late. It was a pleasure. So I hope to do more sessions to you all. You all can give me ideas, what you all want. Very important is a feedback to me. I hope I did justice to this session. If anybody wants to come in, again, you're welcome. Otherwise, thank you so much. Right? Take care of yourselves and thank you so much.
Thank you so much, sir. On behalf of Rajivan sir and Mauro team, I thank you very much.
Okay. Thank you so much. See you all soon. Take care.